Good. Hi, everyone. All right. We're just going to get going. I've been fussing around with Canva for too long. So, hello, everyone. It is Labor Day. Happy Labor Day. I'm going to try and rearrange this. I am not a very organized YouTuber. I haven't done this in a long time. So, apologies. Yeah, I don't know what's going on here. Anyway. La 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 la. I don't know. Anyway. All right. Well, you got a shiny face today. I'm not fucking with it anymore. Anyway, I hope everyone's doing well today. I will try and look into the camera. So yeah, hi. This is Out of the Forest. I hope everyone's having a nice Labor Day, relaxing, doing what you need to do to regroup. I am going to talk today about something that has really been bothering me a lot with regards to what is going on in our world. My video today is called The Healthcare System, and it brings up Robert F. Kennedy. And the reason why I'm bringing up about Robert F. Kennedy is the fact that I think there's a lot of bad discussion about him, and a lot of it's coming from the left. I've been very critical of the left with regards to how they are like treating him, etc. Now, I'm going to say this as a disclaimer. So I am liberal, and I know that people are going to, you're not liberal, you're a Republican Trumpster. I've never been a Republican Trumpster. Okay. I hate the man. I am gleefully waiting for his certain demise. But I'm not a Trumpster. I did support Robert F. Kennedy before he joined the Trump administration. But just for the record, Robert F. Kennedy has always been a Democrat up until this turnaround. And, you know, a lot of people on the left are not happy with the Democratic Party. And you kind of got to sit back and go, well, why is that, right? Like, why is, why is there this, hatred right now of the Democrats? Okay. It's frustrating because there's a lot of people who I think don't and ignore all that back there. I'm embarrassed. I don't have a studio. I don't do this. I don't have time. I work 37 hours a week. I work as a mental health records coordinator for a nonprofit mental health agency. So I have a lot of adulting to do, right? And I decided I have not had time to come out and talk. But anyway, so, but this issue about healthcare is really, really, really critically important to me. And I'm sorry. I'm just going to keep talking. I don't really care. I'm not going to get any people anyway. All right. There, Beth. I was trying to find my powder. Healthcare for me is a really important subject. I am not a doctor. I am not a scientist. I am not, I am in the healthcare field very cursorily. I have an undergraduate degree in communications. I have my master's in library science. I am not a doctor though, but I care about my health. Okay. And I will point out, and so a lot of people right now are coming down really hard on Robert F. Kennedy. Maybe some of the criticisms are valid, but it bothers me because we are in this situation right now. We're in this situation right now with our healthcare system being completely in shambles. And I know it's very chaotic. And honestly, I have to say that Robert F. Kennedy is one of the most refreshing voices that I heard in decades. Okay. I think he's completely right. I know that people are all going, but he's anti-science. He's not anti-science, folks. And I will get to the reasons why I think that tactic or that accusation is completely incorrect. I think that people need to really come to a better understanding about things like appeal to ridicule, appeal to authority, appeal to experts, etc., and do a better job at definitely do a better job at I'm trying to do a better job, okay, at formulating their arguments. And I think it is really, really important because this is such a critical area of our society. And I think it is a multi-headed hydra. There's a lot of stuff that's coming into what is going on with regards to our healthcare system. There's a lot of actors. There's a lot of influences. There's a lot of whatever it is that is coming together. It isn't just one thing, right? It isn't just this part or this part. It is a lot of parts. It is very complicated. And we need to really start treating it as that instead of attacking somebody who I believe earnestly really does care about people's health. For anybody who is going, I don't want to listen to you because he's got a brain worm, he was a drug addict, he's whatever, he's did a bear, oh my God, the whale. I mean, people, do you understand that those are distractions? Please put those aside for 2 seconds, okay? Please just listen to what you're saying. You are so reactionary and you're not listening to facts, okay? You're not really absorbing this material. You're attacking somebody who actually is bringing up some very good points, things that we need to have serious conversations about. And we're not, because we're getting distracted about the fact that, oh, he's got a brain worm, or, oh, he did something to a bear or to a whale, or, oh, he works with the Trump administration, or whatever it is. Okay. I'm not saying he is faultless. I am not saying that he is perfect or that we should worship him or that he is without fault or that he doesn't speak as well as maybe he could or has responsibility to. I'm not saying that, okay? But I'm just trying to point out that the overall issue that we're in right now with regards to our food system, our healthcare system, the outcomes for everything is critically serious. The United States is last or second to last in all the developed nations. This is something that is not new. This didn't happen because of Trump. This has been going on even when Obama put in the ACA. Okay. And that's another issue that I will probably bring up. Okay. Because the ACA, ironically, was a plan that was designed by Republican Mitt Romney, who was a Republican. I don't think he was a libertarian, but he may have been. But that came from Massachusetts. Okay. And it was a plan that, to be very honest, was developed by was developed by the insurance companies. The insurance companies, when they came to the table to develop the ACA, which needed to happen, it was a foot in the door. It was not perfect, but it was a foot in the door. They had, I'm going to just be doing my makeup. I know that sounds vain. I'm talking about really important stuff, but I can't. I'm looking at myself in my camera. Again, I don't do this for a living, so I get on here like once in a blue moon. I should have gotten the darker one. Anyway, who cares? But whatever. I'm just like, I want to look a little bit decent. Anyway, I know I'm vain. Anyway, but the ACA was not a perfect system, but it was a foot in the door that was way overdue and having to happen. Okay. To understand that our healthcare system, the United States healthcare system, runs the way it is. We're one of the few that has this privatized weird thing. And then, now you've got Trump, who's basically gutting Medicaid, gutting Medicare, gutting all of these provisions. It's horrible. And you're right. Why is Robert F. Kennedy Jr. there? Support all that stuff. Understand that the information that we're getting from the press, the information that we're getting from out there is not necessarily going to be accurate. You should know that by now, right? Like, we're getting a lot of stuff thrown at us and it is not necessarily accurate. It is designed to piss us off. It's designed for sensationalism. So we really need to kind of take a step back. I've always stated to people, I said, go back like 20 years, 15, 20 years to, or 10, even 10 years to Robert F. Kennedy's speeches and the work that he did with regards to the environment. He was one of the first people that successfully sued Monsanto. Now, Monsanto has now been bought out by Bayer, but Monsanto, if everybody should know this, is that they developed glyphosate, which is Roundup. Okay. And Roundup has been sprayed on all our crops. We have GMO crops that are quote unquote Roundup ready. They call them Roundup ready crops because they spray them with this glyphosate and among all this other stuff. Right. And the way our GMO crops that are put into all of our processed food, okay, our wheat, our soy, our corn, okay, all of those are GMO crops, okay? And this isn't something that is really allowed to be talked about in the press. Why? Because the press is owned by these multinational corporations and they dictate what is allowed to be discussed, okay? I have studied permaculture. I practice permaculture. There was a really good person, and I'm blanking his name right now. It'll come to me. He gave a really good speech and he talks about the whole history of wheat, and that modern wheat that is GMO developed and everything is a very different wheat than what we had 100, 200 years ago. Okay. You can get better wheats, einkorn wheat, etc. That is more nutritious. But a lot of this stuff is affecting our health. Okay, just fact. This is something that I have been studying for many years. I've worked with permaculture practices. I've taken a permaculture course, so I do understand how our environment and how we grow food, how we eat food, the food that we eat that's developed, that's processed to us is a really serious problem. And I have read comments on all of these Robert F. Kennedy, all of, all the criticism about Robert F. Kennedy, and people like are freaking out. People that claim to be doctors are freaking out going, oh my God, we work so hard and, to help this. And he's saying that doctors don't do anything and doctors are the problem. The majority of doctors are the problem. I didn't have a very good doctor. I think that, like I said, this is a multi-headed hydra problem and that we have to address the elephants in the room. It is the pharmaceutical companies. It is the insurance companies. It is the administrative for-profit healthcare system. It is the private equity systems. It is the food industry. It is insiders that are dictating and controlling and lobbying United States governmental policy in order to promote a certain ideology or a certain uh, nutritional practice or whatever in our society. Why? Why do you think? Why do you think they would do that? That's right. Profit, right? We live in a capitalistic nation. We have become such a psychopathic nation, such a sociopathic nation that we don't realize how integral and how manipulated the United States public has been because of all of these policies that have ended up going into government. For instance, the food pyramid. Yes, the food pyramid is no longer in place. We have this plate system, right? But the food pyramid came out of a poorly designed study. And I'll say, I am 57. I was born in 1968. Okay. I am very attuned. My parents were very mainstream. Okay. Um, My mother was a doctor. She was an anesthesiologist. She worked long hours at the hospital. My parents were divorced. Um, at the time, we had a lot of convenience meals. So when I was growing up, we did have a lot of TV dinners. My mother did know how to cook, but it was very basic cooking. I mean, she wasn't a gourmet, but she did cook. She did cook well. We had things like um, chili, we had spaghetti, we had meatloaf, we had whatever. We had the Stouffer's stuffed peppers. I remember we had, and she did the best to make sure that we had a sit down meal for many years. Then we got a microwave, and then everything went. I did have a caregiver that took care of me, was there when I came home from school. And for whatever reason, and again, this is the 1970s, right? I was allowed, because nobody really thought about it. Like nobody really kind of considered it, right? It was just out there. I would eat super sugar crisp cereals every morning along with white butternut bread toasted with margarine and some jam on it. So I don't know what kind of jam. And guess what? I would have to drink a Mountain Dew. That was my breakfast every morning. I have been diagnosed with severe anxiety neurosis, ADHD, anxiety, depression. Okay. That was something that followed me from a very early age. I was very hyperactive, very distracted, had a lot of emotional dysregulation in my system. Now, I'm not saying that was a direct result because of my diet. But the reason I bring that up is because fast forward to like the last 10 years of my life, keto's come on board. There's been more information with regards to healthy fats, etc. So when I was growing up, carbs and pasta and bread and everything, that was the foundation of our healthcare promotion, right? Like it was easy calories, they could get it out. I remember my dad even stating that, oh, pasta's a diet food, right? I had lots of memories of me. Like I said, I had a lot of emotional dysregulation. My mental health stuff would, I'd be all over the place. But I also had a lot of what are called, the hangries. Do you remember a few years ago, several more years ago, when Snickers were putting out advertisements to people saying, oh, do you get the hangries? Here, eat a chocolate bar, right? Because people would need those, oh, I need more calories. I need more kind of a boost or an oomph, in my in between lunch and getting home from work. And so they would say, here, eat a Snickers. And it would like cover your energy level so you wouldn't get all grumpy and angry. When you're grumpy and angry, That's probably a blood sugar issue. It was a blood sugar issue for me. I could feel it. I could feel my blood sugars plummet, and I'd get really super irritable and angry, and nobody would want to be. And I became very self aware of this. I'm like, I need to eat. I need to eat. I need to eat. But I didn't have the peace at the time that I really should be cutting out all the sugar. I should really be cutting out a lot of these carbs and these sodas and everything, because that was what was contributing to those ups and downs. Okay. That is my story. Okay. Fast forward, I've suffered from chronic fatigue. I didn't have any doctors that talked about vitamins. They never talked about diet. I went to my primary care physician at one point, and because I was really suffering from chronic fatigue, I'd be so tired and so exhausted, I would have to take naps on the floor of my office. I'd lock my door and I would take naps for like an hour because I was so tired. I had massive brain fog and nobody did anything about it. Like, I would talk to my doctors, they blew them off. So I had to do my own research, which was then also ridiculed by my doctor. Like, don't go out on the internet. Don't, that the internet, that's just crazy stuff. That's dangerous. You should be talking to your doctor about this. Like, they always wanted to funnel you, talk to your doctor, talk to your doctor. And if you provide any kind of seeming medical advice to the public, you're like, this is not meant to be medical advice. Go talk to your doctor. That was a legal statement they would put in so they wouldn't be sued. Okay. Even though they're like, well, I'm not a doctor. Like, I'm not a doctor. Okay. So yeah, you're right. You need to do your own homework. I'm not telling you how to, because every single person's different, but I'm just telling you how the system has been rigged. So I go to my doctor one day and I'm finding out about D3. I'm starting to find out about fats and a lot of that stuff and about carbs and everything. And I go to her and I say, maybe I need a B12 shot because I'm so tired, right? And she summarily dismisses me and says, we don't do B12 shots anymore, meaning, I guess, the monolithic medical community, right? That, quote, and this is literally quote, you get everything from your diet. Okay. That's what she told me and dismissed me. And I went on my way. That evening, I went to the health food store where they actually were giving out B12 shots every weekend. You could go into the back room of the health food store and get a B12 shot. Okay. And I got him twice. And the second one, he hit a muscle and it kind of hurt. But I was also doing research about D3, etc. I asked her to also test my D3 levels, which she was very reluctant on. I was really, really, again, like, I was really struggling with brain fog and low energy and everything. And it was really troubling. And she eventually said, okay, fine, I'll put in for a D3, found out, and by that time I'd already started to supplement a bit, and I started to supplement not just with the quote unquote official recommended dosages. I was kind of not really mega dosing, but I was taking a lot more because I was going to the D3 council and figuring out what the appropriate parameters and the formula that I needed to be taking in order to really be getting my D3 levels up. And so, but I was still below. I was still deficient. And so she's like, and all she's like, well, you can go ahead and supplement. She didn't tell me how much. She didn't recommend any brands or anything. She just said, you can supplement. So therefore, I had to go out and figure out, how am I going to get my D3 levels up to an optimal range? I had to do that. She, the doctor, didn't know anything about that, obviously. She just is like, okay, whatever, supplement, because they don't get trained in that. Fast forward to a couple years ago, I went to see her. I was not doing very well again. And she was more focused, honestly, on making sure I got my COVID and my flu vaccines. And I'll deal with that in a later discussion. But I was really depressed. I was dealing with massive like brain fog. And I said, I really want to get my D3 levels checked again because I was afraid because I don't go out enough, I'm older, etc. And she's like, well, you're not deficient, because she was basing it on a year's value from a year ago. And so she wouldn't order me another level test, like to check to see, where are you? Have you maintained this? Yeah, a year ago you were fine, but a lot of stuff happens in a year, right? you know? And so I was frustrated with that. And then she was lecturing to me about how I wasn't getting my COVID and my flu tests. And I was like, I just would prefer not to get those. There's other things that I do to maintain my immune system and take care of myself, etc. And she starts rolling her eyes. And I said, I supplement with vitamins, etc., etc. And she said, those are all sawdust. And she rolled her eyes. And then she's going on to the next, like, well, I do see that you did get your shingles test, your shingles vaccine. And I told her, I said, yes. I said, so you can see I'm not an anti-vaxxer. I am not against vaccines. I just don't feel that the COVID or flu vaccines have helped me. Okay. And I still don't. I don't think that they were ever going to help me. And the ironic thing is that a lot of people that I knew were always getting their flu, COVID vaccines, and they kept getting COVID. Like they just keep getting COVID, and I'm like, but I thought you got vaccinated, and they just, oh yeah, I got COVID again. I got COVID one time. I got the Johnson & Johnson vaccine in 2021, and I got COVID once that I know of, that I tested positive for. And I could tell I was sick. I mean, it's not fake. I'm not one of these people that says that it's fake. It's real. It was real. But I just was like, you know what? I do colloidal silver, which is also something that people don't really understand about. They ridicule, they hear about, oh, you're going to turn blue. That's not what that's about. And do your research, do your homework, and administer it properly. But it can work. The minute I start getting a sore throat, I do a little spray of that. Next morning, I'm not sick. Okay. That's happened to me. Knock on wood. It's been working fine. I try to maintain my vitamin levels up. I try to eat well, stay well hydrated. All those kinds of things have helped me. I have not gotten sick. Like I haven't had the flu. I haven't had COVID. I haven't had anything. I may feel a little under the weather at times, but I don't get full blown, I got to lay in bed drinking chicken soup sick. Okay. Knock on wood, that won't happen to me. I'm not saying it couldn't, but I do try to just keep up on it. And recently, I've been shifting my diet to basically heal my gut biome, because I think that there's been, and if you do supplement with colloidal silver, it is recommended to maintain, eat yogurt and beneficial bacteria, because it can do that. I mean, it's there to kill, bacteria and viruses and stuff like that. But anyway, that is my story. That is my background, which I have repeatedly said. And the reason why it's important to kind of understand where I'm coming from is because everybody has a story. Okay. Everybody has a story. Everybody has healthcare issues, have had healthcare outcomes they were not happy with, their struggles, their worries. They've had surgeries. They've had over and over and over again. And I have heard stories from people who were never happy with their doctors. The doctors ignored them, blew them off. My uncle, who had pancreatic cancer, he went to, and this was during COVID, right? So it was very challenging to go and get health care during that time in battle. He was taking I'm trying to remember, it came from Brazil because he had a cousin in Brazil, and he would get this medication that was a dog dewormer, I believe. I'm trying to remember what the actual drug was. I think it was something to do with being a dewormer for dogs, right? And he was taking it, and it was actually improving his cancer markers. So he was doing a lot of the reversal on that. And he struggled getting that because of the whole COVID, everything shut down thing. And he had I remember talking to him after he had gone to his oncologist, and he was really frustrated. And he says, "I hate these people." And he was a doctor. He was a neurologist. He knew the medical system, right? And he said, "They just blew me off. They said, I don't really care what you do." That's what they told my uncle, who had, this is in South Carolina. I've had other people that I know who have been injured by poor prescriptions, that doctors have prescribed them things and the prescriptions harmed them. I have a friend in England who dutifully got her COVID booster, and the next day she couldn't speak and she couldn't talk. She couldn't speak, she couldn't swallow. She actually started experiencing symptoms almost immediately afterwards, but she woke up and she couldn't talk. And so she goes to hospital, and she was in there for a week. And the doctor said, "Okay, no more COVID boosters for you." Okay, so she had had a mini stroke, basically. So these are people that I know. They're not just they're not just anecdotal stories. "Oh, my sister's doctor's dog," or whatever. These are people that I know personally and that I talk to during these things. And so, I'm not very happy. I don't know why anybody would sit there and be protecting our system. Now, I'm going to say that you're right. Trump is doing a massive, massive, massive destructive, scorched earth policy on Medicaid, on Medicare, the whole 9 yards. You're right. They've gutted money. I'm very concerned about my mental health agency, which relies considerably, primarily on Medicaid funding. We are now no longer to have any kind of groups, or we're not allowed to bill Medicaid at all for any kind of transgender stuff and any GLBT stuff. So it's already affecting us. Okay. And it's tragic. It really is. Okay. So I'm not defending the Trump administration. I am just merely trying to get people to think about working towards something that is good. Now, I know that Robert F. Kennedy tends to be very critical of vaccines generally. I've listened to him about certain things. I have really tried to be thoughtful about, some of the research. I think that overall, there has to be a lot more research. I think there should be more correct oversight. I don't think that I don't think that we should be having industry insiders from pharmaceutical companies running any of these agencies. We need to have somebody who is objective, who is sitting outside and being able to manage this from a more skeptical performance. Now, and so, when Robert F. Kennedy was declared the HHS secretary, I was very disappointed, just because I was very disappointed that the Democrats basically threw him under the bus over the vaccine thing. I think that there's a larger conversation that needs to happen about the vaccines. Again, I'm not anti-vaccine. I am anti-COVID vaccine. I am. And I actually have a provider now and a cousin who they're in the medical field, and they don't trust the mRNA vaccines. So I think that, people want to sit there and go, "Oh, but it's brand new and it's science and blah, blah, blah." And, they worship them. Like, you should be a little bit more critical of that. I have another cousin up in Canada. She was not recommended to get the COVID vaccine because she had been injured by a drug called Vioxx, sorry. And it was for inflammation and arthritic and I think it was pain relief for athletes, right? And she was very athletic, and she was prescribed Vioxx, and she ended up having a heart condition. And so it was recommended that she do not take the COVID vaccine. And because she was directed by her doctor not to get the COVID vaccine, people around her, friends, family, ostracized her and basically treated her very badly. Like, they're like, "You're a demon, like, get away from us," right? I mean, this is what happened. And, it's troubling that this is the kind of divisive attitude that we have in our society. So one of the recent things, I'm trying to think here. So we all know how expensive, sorry, I've got a bug flying around here. We all know how expensive and how poor the outcomes of the United States healthcare system is. It's nothing new. I think that Obama did try to do something about it, and then the Republicans just kept dragging it down and trying to destroy it. And they possibly have won through this Trump administration, that they are going to get rid of the ACA, and we will be back to having zero insurance access, zero insurance protections. If you do get insurance, it's going to be owned by a for-profit, industry like the United Healthcare, etc. It's not going to be good. It's really not going to be good because the Republicans got their way, MAGA got their way, Trump got his way, and that's what they're doing. So yes, there is this weird incongruousness between what Robert F. Kennedy claims he wants for this country versus what the government is doing. He has promoted ideas such as self-empowerment, which I am completely for. I think that we decades and generationally been trained up to accept a sort of authority from our medical and establishment, right? Like, you, the patient, are dumb. You go to your doctor because they're knowledgeable and they know everything and they fix you, right? They give you a drug. They do their little exam. They will, oh yes, I am all powerful. And there's stories about that all over the place, about how the ego of doctors and, oh, I know everything and blah, 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 blah. And then you've got these poor nurses and they're like, well, this is what I'm seeing. And the doctor's like, oh, how dare you criticize my authority and all this. And, they don't care, because they think they're gods, right? We hear stories about that all the time. They, because of the way everything's set up right now, we have an industry that gives maybe 10, 15 minutes for that doctor to come in and see you. Okay, which is gross. If you have the money, you can pay for a boutique plan and get up to an hour. You can get all sorts of neat little things, but that's only if you've got the money to do it. For us, rest of us schlops that just have standard insurance or whatever, we have to pay co-pays. There are long waiting lines. Sometimes it depends. It depends on what industry you're in, like what do you need done, right? But usually the fixes for any kind of, I remember years ago, and I didn't do this, but I think the last time I actually had antibiotics was possibly in 2008 for a recurring respiratory infection, because I couldn't get rid of it on my own. And this is before I knew mostly about colloidal silver. Colloidal silver probably would have treated it. But at the time I didn't know that. So I went back and I got on an antibiotic, cured it, cleared it right up, right? My mother had been on recurring antibiotics as well because she had pneumonia. This was something that was chronic, and she had a lot of pulmonary kind of lung issues, etc. And so she was very always on rounds of antibiotics, which I was always like, take yogurt, mother, take yogurt. And I was not as informed on how a good protocol for her to do, but I think because she was told, oh, you're getting, she'd been in the hospital several times she's a smoker, and she had gotten in, with pneumonia, and she was in the hospital. And so she had that. She ended up dying in 2010 after she had been diagnosed with lung cancer. And looking back, I wish we had not gotten that surgery. She was not healthy enough to actually handle a major surgery at that time. And of course, this was also before cannabis legalization and medical cannabis in where she was. And so we weren't able to give her that kind of treatment or medicine, which that could have possibly reversed her cancer, right? But we were shoved into surgery. Surgery was probably not the best thing. She was on oxygen, but we just felt like that was what we should do to get rid of the cancer. She never got out of the hospital. She died in the hospital. She was in the hospital for over 8 weeks in intensive care. I never spoke to her again after that because she was intubated, and she was so drugged up. And I never spoke to my mother again. I went to the hospital every single day except for one day. And I would speak to her. And she was just, they had her so drugged up and on an intubator. And they got the cancer. They removed the cancer. But her lungs ended up getting a viral an infection because she was very susceptible to this. And there was a fungal infection that you often get in hospitals, and that's what killed her. It just basically took over. She lost her kidneys, started failing, everything started failing. And it was because of the intervention of the hospital that I believe, and this was a hospital she worked at for her entire life. I was a hospital. And I'm not saying that the people didn't try and do their best and they weren't kind, but it was that kind of intervention that I believe probably ended up killing her. Honestly, it didn't help her. And I look back and I go, could anything have changed? Could anything have changed for my mother? Right? Because you would have an event and she had to be on oxygen and we ended up intubating her. I mean, these are all very invasive things. She had a central line. I mean, just her whole body was failing because she was not strong enough to handle this surgery, this invasive surgery to remove this cancer. And, it's a scary thing. And she was terrified of that outcome. And it ended up coming to be. She didn't want to die in the hospital. She was a doctor. She knew how it was. But that's our healthcare system, right? Invasive surgeries. We don't look at health, nutrition, that kind of stuff. We don't look at how did we get here? What can we do to reverse cancer, right? And after she died was when I was starting to see more and more research about how cannabis and cannabis oil, and there's the Simpson oil, that could have possibly, if we had gotten a hold of it, could have treated her with that. There was a lot of other options that I think that would have given her several more years. And because of our healthcare system and because of the lack of information and the lack of control we had about any of this, that is what ended up happening. And I'm angry about that. Okay. And I think a lot of other people have stories like that. So to sit there and say everything is fine or we should just trust the science is devastating, right? Like, I know that the COVID pandemic was a scary situation, but there was a lot behind that I think made it worse. And bear in mind, guess who was president when COVID came about? Remember? It was Trump. He's the one who fast-tracked the whole COVID thing. And everyone's like, oh, trust the science, these vaccines. Like, we were brainwashed into believing that this magical vaccine was going to solve all our problems. And the science doesn't necessarily, I think the science, when you go 20 years from now and they look back, if all that research hasn't been destroyed, you're going to find that the COVID vaccines were not all that. They really weren't. And people tend to forget. They go, oh, but they were vetted. They were put out as an emergency approval, okay, which means that they had not gone through all of the steps required to do this. There was a girl who some of the studies were done. Some of the studies were done on children, on young girls in Cincinnati. And there was this one girl that was part of the trial, and she was injured. And I have to actually look her up to see what ended up happening to her. But she had a vaccine injury. She was in a wheelchair. There was a lot of stuff wrong from her, and it came directly from the vaccine. Okay. And she tried to testify, but a lot of this stuff, anybody who was criticizing the vaccines were silenced. Okay. which was very troubling because we were so in fear-mongering mode about, oh my God, COVID is going to kill us. This is the only solution. This vaccine is the only solution. And that was what was promoted. There was a lot of doctors that said, hey, we've had luck with this, even the whole ivermectin thing, right? But there was a lot of things, and it was ridiculed. It was silenced. People were lost their jobs. They were silenced. They were death threats. I mean, the whole 9 yards. If you criticize the COVID vaccine, you were persona non grata, because that was the only solution that we had. And going back now, a lot of the people that died were people that they were doing things like that did have other comorbid health issues, right? Diabetes, age-related stuff, obesity, that kind of stuff, right? Like they had all these other comorbid. They were the ones that were more likely to die from COVID. Okay. The other impact was the fact that we took remember the whole, we've got to get all these oxygen machines, right? And we had a whole army. Oh my God, all these like massive solutions to everything. Oh, isn't this great? And it was such an obvious thing. Instead of actually really rationally looking at who are the ones that were more likely, we closed down the entire economy. We isolated people. People died alone. People died on intubating machines. The whole 9 yards. It was a horrible thing. And that was due to the choices that we made and how we treated COVID, because it was a fear-mongering thing. Oh my God. I wasn't even allowed to even speculate the fact that COVID actually came from a lab. You're not allowed to say that. And even today, it's like there's people who are like, no, it came from a lab. And people have admitted this, but they're still trying to bury it, right? It's just insanity, right? So my whole point is that we are told things by the media, by authority figures that are not necessarily the truth. And we are fearful, we're scared, or that we've been told to trust the science or trust our doctors or trust the establishment and trust the government and trust this, that they know best. But the thing is that often they don't. Okay. I know that's going to come as a really hard thing for a lot of people to accept, but that is not necessarily true. There are great doctors out there. There's great scientists out there. There's a lot of really great things out there, but that isn't always the truth, right? That's not always the people that are running things. Now, so that's kind of the background. I've spent almost an hour talking about the background. So, and just so you remember hold on, trying to get my notes. Hold on 1 second. Sorry, I closed my file that I was going to bring up. I'll bring it up again. So basically, I want to mention, so right now in the news, there is a lot of criticism about how Robert F. Kennedy Jr. doesn't have any experience to talk about or run the head of the Health and Human Administration services. And I went through and I looked up who have been previous HHS administrators, secretaries, right? Let's see. So, okay. So some of the people, so say, oh, he doesn't have any experience, or they'll engage in other ad hominem attack. Oh, he's a drug addict, he's a heroin addict, he's got a brain worm, he's this, he's that, right? Like, I mean, they're all ad hominem attacks. They don't have any legitimacy. And the fact is that Robert F. Kennedy was an environmental attorney. He successfully sued Monsanto when, on behalf of a client of his that ended up getting cancer from glyphosate. He was one of the first people to do that. Now, at one point, and Monsanto is now owned by Bayer, but they are the ones who developed glyphosate. And there are class action lawsuits all over the place due to glyphosate. We are brainwashed to believe that we need this in order to feed the world, okay? Which is a lie. And there's a lot of stuff. There's another person that you should look up. Her name's Vandana Shiva. She has been a massive advocate in India against farmers being forced to use GMO seeds. Okay, and people go, oh, but GMO seeds are going to help feed the world. Go look up Vandana Shiva. I mean, there have been farmers' suicide in India. Monsanto has been an absolute disaster, okay, for our food supply. And we are being fed glyphosate and GMO foods, and we can see already how the outcomes, they're not good. I was shocked. This is really kind of just an aside. So I'm 57, and several years ago, Lisa Marie Presley, who was only a few months older than I was, she was born in February 68. I was born in May. And I never really followed her that much. You knew of her because she's shocked when she died. I was like, wow. Because I remembered seeing some really incredible, I didn't know she had the problems that she had, right? And she, apparently she had she had some weight issues, and she had bariatric surgery, and apparently it was complications from bariatric surgery. And I'm looking and I'm like, I didn't even know that she was that heavy. But she also had an opioid thing, OxyContin. There was some other stuff that, she was in the whole Hollywood and the whole music industry kind of stuff. She had her own personal demons because of her dad, who was a big drug addict. I mean, and Elvis, he died of drug overdoses, right? Like, people were just feeding him drugs. Michael Jackson feeding him drugs. Lisa Marie feeding her drugs. I mean, all these people, all these famous people that died either by age 50 or below over drugs, right? Like, people were just feeding these people prescription drugs. Prince, again, he had, I don't know what specifically, but all these people are dying because of pain medications. Famous people have died, and they have all the money in the world. So why are they dying? Why is this allowed? I mean, people aren't really thinking about this too closely. Like, people that trust their doctors, right? And I go, remember the OxyContin issue, the opioid epidemic? That was helped perpetuated by doctors. People were like, I am in pain. I have a back injury from work. They were prescribed OxyContin, and Purdue Pharma said, no, these are completely safe. You can prescribe them, and they're non-addictive to your patients. And the doctors trust Big Pharma, and the patients trusted their doctors. And voila, we ended up with a frickin' multi-billion-dollar frickin' heroin opioid epidemic. That included doctors who ended up being pill merchants, who ended up taking the drugs themselves and becoming addicted to them, on and on and on. And this is why I criticize Big Pharma. Anybody that sits there and says, oh, they're, whatever. Like, why would you trust that? I mean, Pfizer, who developed the COVID vaccine, they've had several lawsuits, right? I mean, why are we trusting these people all of a sudden? Why are we giving them a pass? Why are people freaking out on all the comment boards, right? About how Robert F. Kennedy is going to come after my antidepressant. Robert F. Kennedy is going to come after my Adderall. And they're freaking about that, right? They're like, oh my God, he's going to take away my drugs. He's going to take away my drugs. Instead of actually going, if you're on an antidepressant and Adderall and it works for you, great. But we were sold a lot of antidepressants that didn't do shit for people. And if you go through any discussion board about antidepressants, about these antipsychotic drugs, any of these things, you'll find a really mixed bag. There's a lot of people who have been like, I've tried this, I've tried this, I've tried this, and they still end up killing themselves. So pharmaceuticals are not the answer, folks. I don't understand. If they work for you and if you find it and it saved your life, good. It worked for you. But the pharmaceutical industries marketed all of these drugs to people, all of these antidepressants. I was on Prozac. When Prozac came out, da 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 da. And I did it. I gained a lot of weight. And it didn't really help me. I then subsequently did Effexor, Celexa, the whole 9 yards, And when my father died at age 60, I was on one of them because I was dealing with depression, post-college depression. I was just struggling through. And I realized I could not cry. I had a very, very flat affect. And I was unable to really process a lot of my emotions about my father's death. And I remember I had for several months in order to do that. That was disturbing to me. And it actually delayed my natural response and my natural grieving process. I was in grad school and holding that back in and not processing that stuff appropriately at the time ended up fast forwarding when I was starting to get some actual treatment. I got some structural therapy work, some body release stuff, Rolfing, that kind of stuff, like just emotional body release stuff that I actually started to heal. And I probably need some again, because life is just pounding on you, right? Read Body Keeps a Score for that. But anyway, I went off of the drugs because I couldn't afford, like I was in between insurance and the insurance, I didn't have any way of paying for these drugs. So I was getting a lot of samples from my doctor, which, and none of this stuff was helpful. None of it. I mean, it didn't really fix my problems, and it didn't really allow me to grieve or have a natural process of grief. And so it caused more problems than it worked. But, so in rolls Robert F. Kennedy. And I think a lot of the stuff that I've listened to him, he's right about. And I know that people aren't going to like to hear that, but he is. And I think there's a lot of things that are going to be taken out of context. For instance, he recently discussed about diabetes. And he said diabetes, that most of diabetes can be reversed or healed by diet. People flew through a fit because they're like, oh, I'm type 1 diabetes and I can't change that through diet. No, you're right. Type 1 diabetes cannot be treated by diet. That is a genetic medical issue. Not talking about that. Was Robert F. Kennedy being a little sloppy in his language? Perhaps. You could criticize him, but people were misrepresenting what he was saying about that. The thing is that type 2 very much can be reversed and treated with diet. It's not a death sentence. It's not something that you're going to automatically have to go on insulin for. Okay. Now, granted, you're right. Everyone's different. Everyone's biological needs are different. I can't say that you've got all these other health issues or genetic or whatever. You do what you need to do. But the diabetes epidemic that we're seeing now is primarily type 2 diabetes. It is directly tied into our diet. Fact. Okay. I'm not talking about type 1. Okay. I'm talking about type 2 diabetes and our diet. That is a fact. Okay. If you really think that people are healthier than they were 50 years ago, you're crazy. Or that people were healthier than 100 years ago, you're crazy. We're not. Our diet, the way we live, our sedentary lifestyle, all those things. And that's all that Robert F. Kennedy is talking about. And yet people are going to sit there and deliberately misrepresent his position about that issue. And he's 100% correct on that. Okay. He also talks about treatment, substance treatment. Now, yes, he has had a heroin issue, right? Like he was a heroin addict many years ago, right? Okay. And yet people want to bring that up and say, well, I don't want to listen to somebody who had a heroin overdose or it was a heroin addict. Okay, that's a fallacy for one. It's also ableism. If you actually even ever supported Biden or was ever sympathetic to Biden's son who had a drug and substance abuse, which I believe was Hunter, actually, then you're a hypocrite. You're a hypocrite, right? Like people, we are on the left, we are supposed to be compassionate and understanding and give people second chances about substance abuse. So why are people out there condemning Robert F. Kennedy for something he did like 30 years ago, right? Like, understand what you're saying. Like you're sitting there and you're saying, oh, well, I don't want to listen to him because he was a heroin addict. Okay. So you're going to basically show zero compassion to people who have had substance use issues. Okay, then, I'm not going to talk about anything, the brainworm thing. Okay, you want to talk about the brain? Oh, but he's got a brainworm. Okay, brain parasites and brainworms are actually hundreds of thousands of people all over the world have gotten these. It is due to poor sanitation and poor water. Okay. He travels, he is in all sorts of environments. It was very easy for him to get that. People criticize him. That's a disability, right? Like, I mean, if someone that you loved went and traveled somewhere, ended up getting a brain parasite and was injured by it, would you have ridiculed and mocked them, saying, oh, you got a brainworm, show some empathy. Actually really listen to what you're saying about these issues and really think about what you're saying and how hypocritical you are being. And I'm pointing at you, and I've said this repeatedly, and it gets really old after a while because we have serious issues in this country, and we need to start having healthy dialogues. And by you picking out all of these random things and trying to bring him down over things like, oh, he was a heroin, it's like, look at what is going on now. Listen to what he's saying. If you don't agree with something that he says, then bring the evidence to the table. Don't sit there and say, well, he's got a brainworm, I don't want to listen to him. That's a fallacy, folks. And it pisses me off. You should know better and you should do better. Okay? Period. He helped clean up the waterways. I remember a time when the environmental issues were actually something that were championed by the left and liberals. And yet you've completely thrown Robert F. Kennedy under the bus for all of the work that he did on trying to clean up rivers and the environment. He is very pro-environment and you throw him under the bus over that. You're a hypocrite. I'm tired of it. So those are issues you need to just like really, really examine and quit being, turn in your leftist card or something because you don't have anything. If you care about the environment, in terms of, so people go, oh, but he's just a class action lawsuit attorney, right? Or that he was just an attorney, like he doesn't have any health care. Okay, so I was going to get to this. Sorry. Here are some of the previous Health and Human Services secretaries. Okay. Of course, I don't have their degrees. I had another one where, let's see. Okay, so we had, I'll look these up as we go along. I had a list of them. But the one that was, there was one. Okay. So Kathleen Sebelius was the 21st state. She was an American politician. She served as the 21st United States Secretary of Health and Human Services from 2009 to 2014. So that was during the Bush administration. And as well, no, I'm sorry, not the Bush. She was under Obama. Apologies. She was instrumental in overseeing the implementation of the Affordable Care Act. She was governor of Kansas. That was her background. Now, it's interesting. I didn't know that. So she was public administrator, and she was a political science and public administration. Not a medical degree. She didn't have a medical degree. She was from Cincinnati, ironically. I didn't realize that. Let's see. Who else was in here? Tommy Thompson. A lot of them were governors, a lot of them were governors of states. I don't know. Let's see. He was a famous one, right? What was his background? Let's see. He was a politician. He was a governor. He was the chair of Amtrak. That's not medical related, right? Let's see. What was his degree in? Ooh, he was elected chairman of the Young Republicans. So it doesn't. So he was a Juris Doctor, which is attorney, public defender. He was an attorney mostly. An attorney and a governor. Didn't have a medical background. Let's see. Who else do we have? There were. I will say there were. Louis Sullivan, 89 to 93, was a physician and an academic administrator. He was under Bush. Ironically, a lot of the people that were not doctors were under Democrats, which is interesting. Let's see. Margaret Heckler, who was a Republican. So she, let's see what her background was, because I think it's really important, because people are saying, well, he's not qualified. He's not qualified. Okay, well, who was qualified? What does one make being qualified? And then looking at where we are now, right? Like, are we doing so great in our healthcare thing based on who previously ran? She was a diplomat, politician. She was the secretary from 83 to 85. She had a congressional. She's government. Let's see. I'm trying to think. They don't really cover. Okay. She studied at the University of Leiden in the Netherlands. Law school. So again, she's a lawyer, right? She was a lawyer, governor, honorary doctorate, blah, blah, blah. So again, doesn't really specifically have a medical degree. Like, she's not a medical degree. Let's see, who else do we have? We have, trying to, Ovida Hobby. Some of these, I'm just pulling them out. Ovida Culp Hobby, what a name, right? She was the first U.S. Secretary of Health, Education, and Welfare, which is the predecessor for Health and Human Services, and she served from 53 to 55. She was a member of the Republican Party. She was the first director of the Women's Army Corps, which is notable. That's the thing. But let's see. She was a lawyer. She studied law. She went on to study law at the University of Texas Law School, but did not formally enroll and therefore never received a degree. So she never even actually had an advanced degree. She was a lawyer. Didn't have a healthcare background, but had head of the Health and Human Services. Let's see. Now, the one that was previously before Robert F. Kennedy, this is one should be one that is very concerning. Alex Azar. Okay, Alex Azar was health secretary from 2018 to 2021. Okay, let's see. I'm just pulling these from the thing. So, he was another attorney. Isn't that interesting? Another attorney as the head of Health and Human Services, just like Robert F. Kennedy. Interesting. He was a businessman. Okay. He was a lobbyist. Guess who is he a lobbyist for? And he was a former pharmaceutical representative, and he served from 2018 to 2021. So before the pandemic, right? So, but again, was he a doctor? No, he was a pharmaceutical representative. So his degree was in, he received a BA in government and economics, not medical. Head of the Health and Human Services has a government degree. He knows about government, right? And economics. Law career. So he ended up being under the first George W. Bush, under Tommy Thompson, dealing with SARS outbreak. So he has some boots on the ground experience with regards to some big issues. However, he and note this, he is a pharmaceutical representative. This is Alex Azar, okay, 2018 to 2021, okay, under the Trump administration and part of the Biden administration. Azar was confirmed as general counsel in the U.S. Department of Health and Human Services, George W. Bush's first thing. They said that Azar played an important role in the anthrax attacks in 2021, ensuring there was a vaccine ready for smallpox and dealing with the outbreak of SARS and influenza. On July 22, 2005, Azar was confirmed as the Deputy Secretary of Health and Human Services. He was twice confirmed unanimously by the U.S. Senate. He supervised the operation of HHS, which would grow to an annual budget of over $1 trillion by 2017 when he was appointed secretary. Azar led the development and the approval of HHS regulations led by the U.S. government efforts to encourage worldwide pharmaceutical and medical device innovation. Now, granted, that sounds really wonderful, doesn't it? Like, oh, more vaccines, more healthcare, whatever. But our healthcare outcomes have not demonstrated. Wonderful. you're right. I mean, people in developing nations being able to get tetanus vaccines or other types of vaccines, great. But then there's other vaccines that they're not getting that, is this really overall helping their health outcomes? What kind of medical device innovations? What does that include? Why, wow, we've got medical device innovations. Are they things that anybody can actually get access to? Is it actually improving health outcomes? Those are the questions, and how much are they costing? I mean, bear in mind, we're talking about costs here, right? And he grew the annual budget of over $1 trillion in the HHS. Where's that money? Where's that money go? Okay. And where did that money go to? Whose pockets? I would say probably pharmaceutical and the medical industry, right? The private for-profit medical industry, because he was part of that executive. So, I mean, disagree with me. Disagree with me if you want, but So he led the development and approval of HHS regulations, led government efforts to encourage worldwide pharmaceutical and medical device innovations, and was in charge of the HHS response to an initiative implemented by President George Bush to improve government performance. He resigned in 27. So that was when he actually, that was when he was the general counsel of the United States Department from 2001 to 2007. Okay. Then he went back into private sector and worked for, guess who? Eli Lilly. He was hired by Eli Lilly to be the company's top lobbyist. Okay. And spokesman as its senior vice president to corporate affairs and communication. So he went from government work as legal counsel in HHS to the private sector, and then came back under Trump. Okay. In April of 2009, he became vice president of Lilly's U.S. Managed Healthcare Services and its Puerto Rico affiliate. The company paid $1.415 billion to settle criminal charges regarding its promotion of an antipsychotic drug, Zyprexa, for off-label uses between 1999 and 2005. This is why I do not trust Big Pharma, folks. In 2012, he became president of Lilly USA, the largest division of Eli Lilly and Company, and was responsible for the company's entire operations in the U.S. Prices for drugs under Alex Azar, who is the HHS secretary, rose substantially under his leadership, including the tripling of the cost of the company's top-selling insulin drug. Also under Azar's watch, Eli Lilly was one of 3 companies accused in a class action lawsuit of exploiting the drug pricing system to increase profits for insulin. It was also fined in Mexico for colluding on the price of insulin. So this is the guy that was before Robert F. Kennedy, I think. I don't know who it was under Biden, though, but this was under Trump. Under Trump. This was the head of the HHS thing. Now, you're right. Going, well, now Robert F. Kennedy is. You're right. There's a lot of incongruity. I will admit, okay? There's a lot of corruption. There's a lot of confusion. There's a lot of what's really going on, right? But I think it's really interesting. And it's also really interesting for MAGA, right? From MAGA to sit there and they're complaining about the pandemic and how the pandemic and all that kind of stuff was handled. But that was all under Trump. They want to blame it under Biden, right? But Trump is the one who started all this. Just saying. Just saying. So I'm not pro-Trump. But what I'm trying to do with this whole Robert F. Kennedy thing, I'm like, if there are legitimate criticisms, criticize him on the facts. Don't criticize him based on that he's got a brain worm or that he's uneducated. He's not uneducated. He's a very intelligent person. Okay. Robert F. Kennedy is a very intelligent person. He is an attorney. He is as qualified as any other HHS secretary that I have stated, right? Like they're saying, oh, but he's not a doctor. That's never been a prerequisite to be an HHS secretary. Okay? It's never been a thing to be an HHS secretary, to be a doctor, to be a scientist. You don't have to be a scientist or a doctor to be an HHS. Just pointing that out, okay? So, and then also in connection with the position, Azar served on the board of directors of the Biotechnology Innovation Organization, a pharmaceutical lobby. He resigned from Lilly in 2017 to pursue other career opportunities as a result of company reorganization. He also resigned from the board of directors from the Biotechnology Innovation Organization. And he, at the end, and his last year, he earned $2 million. Now, he was confirmed and nominated by Trump in 2017 as the Secretary of Health and Human Services. Ironically, a lot of people were concerned about his nomination because he had a lot of collusion with the industry, right? So, but his nomination was relatively smooth. And said that when he was at Eli Lilly, he was never not one signed off on a decrease in the price of a drug. So, I mean, just on and on and on. He had initially consulted with numerous other biopharmaceutical and health insurance corporations regarding government policy, product access, sales, marketing, blah, 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 blah. Yeah. Anyway, my point is that if you're criticizing Robert F. Kennedy based on lack of qualified experience or that he doesn't have a background in medicine or that's not a qualification to be an HHS secretary. Just letting you know. Many of them are attorneys, they're industry insiders, etc. Robert F. Kennedy, when he was independently running, he said that he was going to end the corporate capture of these organizations. And indeed, he's done that. Now, I know a lot of people are very critical about, and I have yet to look into why these people from the CDC were fired. It is probably a really hot mess. I don't know how, and I have criticisms over certain other aspects of Robert F. Kennedy, namely his position on Israel, etc., but that's another thing. My point is that there's things that I know about him that I followed way before he began running for office, right? And that way before this. And I'm just noticing, and he was very conscientious about really making sure that citizens had rights in their healthcare system. Talked a lot about that. How our food is safe. How is this? I've rarely heard that from any HHS secretary, honestly. I mean, they're not, they're just kind of background thing. But then suddenly he's talking about getting things like fluoride out of the water, which people really do need to investigate and research. Might learn a bit. And also how the regulatory, and I understand there is a big, it's like, but he's with Trump and Trump does this and Trump doesn't get, and I'm like, you're right. That's a valid concern, very valid concern, but quit ridiculing Robert F. Kennedy based on logical fallacies, people. You really are missing the point. And I think that we need to keep a laser focus on this and actually helping him and speaking out in support for things we know that are critically needed, right? I know that, but he's reducing all the research about this vaccine or whatever. He removed the research over mRNA vaccines. I know of several doctors that actually do not like the mRNA vaccines. I think that it does need to go back to the table. I think a lot of that stuff with the mRNA vaccine technology needs to get back onto the table and be looked at a lot. Okay. I don't think that it's, I do not trust any pharmaceutical company and anybody saying, "Oh, this is safe. This is healthy. This is the latest." Because you know why? And people, you really need to think about this and be very, very, very skeptical and cynical, is because these organizations, these companies are there to make money. And it behooves them to promote their technology, to promote this and sell it to you as this great and the greatest and latest thing, right? Instead of, they've got a lot riding on this. And if they can get the United States government approving and working with this stuff, that's what they want. Now, and the other really ironic thing is that Peter Thiel with Palantir, and some others, right at the very beginning, they were talking about rolling out more mRNA vaccine technology and medicines. So yeah, you're right. There's like this incongruent, like, well, then what, you know what I mean? And you're right. And that I think is by design. I think that Robert F. Kennedy probably was leveraged, like every politician is leveraged. They're probably leveraged by APAC. They're leveraged by other things. They may be under this belief that, oh, well, we can get all this stuff done, etc. And, they believe that they can, and yet up to fail. They're just there as a front person. They're not really controlling anything. Who's to say who fired all these people? Who's to say? I mean, and I think that he genuinely probably wants to care. It'll be interesting what we'll see in 15 years if he survives, But I'm trying to read through the lines, and I'm really just very angry at people who just will not hear this. And we need to change our healthcare system. And I honestly do believe that it's going to require our own personal sovereignty over our own bodies. I think we need to do a lot more research. We've got to stop trusting. When he sat there and said, we need to stop trusting all these experts, people go, oh, so we shouldn't trust experts. And they didn't get the fact that more than likely that is really him being sarcastic. He was doing experts because it is a fallacy it's an appeal to experts. It's called appeal to authority, right? Like oh, well, they're a doctor. They got these things. They must be smarter than me. So I better trust what they say. Should you? I don't know. Like, why are you just automatic? So that's what he's talking about. He's talking about the quote unquote experts, like the people that are sold to you on TV that are like, I'm an expert. I'm an expert. Blah, blah, blah. Trust my authority on this. Trust my expertness on this. Right. And understand that all the social media stuff, all this news, everything is being manipulated, people. It's being manipulated by spin doctors, PR doctors, everything, to basically, because they are threatened by what he would do. If you don't have to take their drug in order to be healthy, if you aren't taking GMO wheat, if you're rejecting all this and you're actually eating better, and we're changing our society, and we're changing and making sure that people are fed well, healthy things, we might not be going to the doctor as much. That's a big monetary threat, right? And you're right. Insurance companies, they're a big factor too. Like I said, it's a big multi-headed hydra. There's a lot of aspects to this stuff that is just, they need to be tackled. But we are being distracted by all this criticism about what Robert F. Kennedy has done. And like, I followed him for freaking decades, right? So I know what he's like. Most people don't. If you're a 20-something, you probably never heard of him until a couple years ago. And it's all because, he's against vaccines. Well, guess who would be promoting all that stuff against vaccines? the big pharma, because they want people to trust their vaccines. They want people, and they want to bury evidence, and they have a long history of burying, burying good science. They bury information about their drugs all the time. They get, they're doing all this stuff. Just look at their actions. So why would you trust them over someone saying, hey, they're promoting this and there's some evidence that this drug may not be safe for you? And then yet you hear all this stuff going, oh, he's crazy. He's got a brain worm. Oh, I can't stand the way he speaks. Oh my God, he did something with a bear. He did, I mean, they're trying to get you off the scent. That's the point I'm making. If there are legitimate criticisms or that he's not qualified, that's just so funny. It's like no HHS service. I mean, again, what would qualify? Many of them are attorneys. Gee, he's an attorney, an environmental attorney. Is having a degree in governmental policy qualification to oversee the Department of Health and Human Services? I don't know. But so criticizing Robert F. Kennedy based upon him being an environmental attorney is ridiculous. Okay. I think that he's got some interesting ideas. I think that people need to keep an open mind about it. I think that people need to really consider what he's saying and take it seriously and do your own homework. And do it from resources that are, there's a Dr. Campbell from England. He's got a PhD in nursing. He's a really good thing. He would break down scientific studies, a lot of stuff. I think there was a lot of stuff that got buried, and it was primarily due to the use of the appeal to ridicule and shaming. And we need to stop this because people are dying. People are still not getting any better. It's really troubling. Like, for instance, here we go again with, I have diabetes. Okay. I'm a little bit overweight and my A1C was up. Guess why? Because I had to take steroids, and steroids will jack up your A1C. But she wanted to put me on Ozempic. I had a cousin who's willing to spend a month, which was like $1,000, which isn't crazy, to buy me Ozempic because she knew that I was overweight, because she was in California. And I was like, no, I'm not going to take that. I don't want it. And my doctor, she's a nurse. She's a PRNA. Wanted to do it, but she didn't push it hard on me. But these GLP-1 drugs, they're performing incredibly, but there is some initial evidence that it can cause blindness and eye issues. So I'm gonna back off, and I'm gonna work with my diet. I'm reading a book called Super Gut right now by a guy, Williams. Did the book on wheat belly, which was the precursor. It was all about, cutting out wheat and all that other kind of stuff. He wrote another book called Super Gut. It's all about probiotics and prebiotics in your gut. I've been doing a dirty version of that, and I'm trying to incorporate more kefir and other stuff into my gut biome and really trying to change that. And I've actually noticed a difference. I was having a lot of inflammation. I had back pain earlier this year that really laid me low. I mean, and then I pulled my Achilles tendon, which then aggravated all that. So I've been limping around, and I've been in a lot of pain. My joints are painful. It's hard for me to walk, etc. And since I've been on this protocol, and again, I'm doing a very dirty version of it. I'm still drinking wine, but I do feel that I'm feeling better. I feel more. I have less brain fog, and I'm not as in much pain. I'm actually able to walk normally. I'm not limping too much. I'm still really cautious when I go up and down stairs because but, and that was all through diet. They wanted to give me another steroid shot, and I said no, but I might have done it because I was in so much pain. Chronic back pain. Oh my God. I don't know what happened. I had fallen. That may have triggered it. But yeah, it was pretty bad, And yeah, I mean, I got a shot. I got 2 shots initially. I got a shot in the arm, and then I was on a series of prednisone, and then I was on prednisone, and and then I did get a shot in my vertebrae on that. But then they wanted to do something else, but I didn't go. But then, I had high A1C. But, it's, a lot of this does have to do with diet. And that's what Robert F. Kennedy is talking about. And he's talking about food. And he's talking about, and of course, the food industry is going to put all their money in those guns to basically attack him on that, and attack him on personal levels, trying to get you distracted, trying to get you freaked out. Oh, I don't like his voice. He's got a brain worm. Oh, he took drugs, blah, 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 whatever it is. Understand that that's coming from them to get you distracted from not talking about this issue. So anyway, with that, I am going to go. I think that there was a couple of other things that I wanted to state. So let's see. Let's see. So oh, I lost it. Wait, here we go. There's something I wanted to end with. Let's see. I mean, I think the whole thing about prevention is generally still ignored until people are really sick. And you're right. I don't trust Trump. The fact that he is cutting Medicaid and Medicare is devastating. It's horrible. And it will cause more deaths because people will not wait until they'll wait until the last minute in order to go and get critical health care. But it's also arming people, and you're right. I mean, the cost of food is going up thanks to Trump's tariffs, due to the immigration stuff. So I know that many of you may have fallen out, or maybe you're staying with me and going, "Hey, you're still a Trump supporter." I totally understand what Trump is doing that is making things a lot harder. I really do. My goal here was not to necessarily worship Robert F. Kennedy. My goal primarily is to try and help people to understand what is being said, and to not just automatically engage in ad hominem attacks against somebody, and to really listen and do your research on it. If he says something, you might want to do some research. I'm not saying I agree with every single thing he says, but it's very hard to get a beat on it because there's a lot of confusion, right? And so, yeah, I mean, it is really troubling right now. I think that, anyway, with that, there was something else I was going to say. But anyway, I think that in conclusion, I think that folks really do need to continue to learn how to learn, to do the research, to engage in more critical thinking, to not fall prey to just random ad hominem attacks. I think we need to talk seriously about things. I think we do need to do more homework. I think we need to remove and decouple ourselves from this culture of obeying authority unnecessarily, saying, well, but our doctors know the answers. Our doctors may not know the answers. And he was completely, like, someone, this is the other thing that was really, really funny, is that he said that the doctors only get a certain amount of nutritional education while in medical school, and which is true. I've heard that repeatedly, right? They may get like maybe a day or something of nutritional information. And I know that's true because my doctor didn't ever talk anything about my nutrition, right? And I don't even believe in nutritionists. I think that there's just, I think the whole American Diabetes Association, just not, I don't trust them because they're like, oh, well, carbs aren't bad. I'm like, okay, simple carbs they're bad. But they just want to ridicule you. They just want to be, and I mean, I see people who literally have diabetes and could be reversed. I'm not talking type 1, I'm talking type 2. And they could reverse their diabetes, and yet they don't know how to eat still. They still think, and then you have to ask, like, are you in oh yeah, I'm on metformin, I'm on insulin. Okay. But no one's ever talked to them and said, you can get off those drugs. But we're scared to, because we're like, but those drugs are saving my life. Maybe they are for some people, but I think it behooves everyone to actually do your homework and do your research with regards to that. Anyway, with that, I'm going to close. It's been almost 2 hours. I got no one listening to me, but at least it'll be out there. So anyway, I thank you very much for taking the time to watch this. If you agree with me, let me know. Subscribe, share. I am long form, whatever. And if you disagreed with me, let me know. I love a good debate. All right, I'll talk to you later. Bye.